Colorado Senate Republicans wasted no time jumping into partisan issues this week as Senate President Kevin Grantham urged a full repeal of Colorado's health care exchange in his opening remarks. While the proposal is unlikely to go anywhere in the State House, the move seemed to mirror national Republican efforts to repeal the Affordable Care Act. David, it's an opening remarks speech. It's purely symbolic, and with the split legislature, the move actually isn't going to go anywhere. But if this is your opening salvo, is this a line of things to come?
Well, of course it is, because in any large human project, it will fail if it's not sustainable. The so-called Affordable Care Act was not sustainable. And some of us, including my colleagues at the Cato Institute, predicted that from the start. We showed in 2010 how the budget numbers that showed this was supposedly going to work and be able to pay for itself and keep going were phony. They were deliberately bogus, fabricated numbers. The plan was sold to the American people on what was known to be a lie at the time. If you like your doctor, you can keep your doctor. If you like your insurance, you can keep your insurance. To the contrary, the plan as it actually existed in the minds of Zeke Emanuel and its other architects was to destroy all that. We've seen many people benefit from the subsidies they've gotten, including the ones who got on expanded Medicaid, and we've seen many more people harmed by it. Enormously expensive policies that they're forced to buy from essentially a single monopoly provider at ridiculous costs, where they get something that is actuarially worth maybe $2,500, huge deductibles, and they got to spend $9,000 or $12,000 for insurance for their family. The exchanges are collapsing all over the country. Providers are pulling out. Something has to be done. Now, the Republicans have the responsibility to come up with something better, but what this thing is collapsing under its own weight. If nothing were done, it would collapse on its own anyway. So we have to move to a more sustainable approach.
In our last round, you had some great thoughts about how there might be some differences in the leadership from last session, so it might lead to some different progress. What was the reaction to Grantham's comments right from this very beginning?
It was interesting. I was in the Senate when he gave his speech, and there just seemed to be this deflation of air from the room as he mentioned that was going to be Senate Bill number 3, which, while symbolic, it doesn't matter what your bill number is, you're going to get a hearing on it anyway. The idea that he would put that out there, and then he very quickly said, after listing the first 6 Senate bills, we hope these are ideas that can gain bipartisan support. Well, of course, the Senate Democrats thought that laughable in regard to this bill, and it is, as Patty mentioned, going to have as you and Dave mentioned, going to have a real hard time getting through the House at this point. I also talked to its sponsor, a freshman senator, Jim Smallwood, afterwards, and his response was, look, this is not going to hurt anyone. We're going to phase that out over 2 years. We're going to move the people who are on there onto the federal government exchange. The question, of course, is, will there be a federal government exchange come 2019 to move them onto? In talking to people, they seem to try to really separate the Colorado exchange. When I'm talking to proponents of this idea, they seem to separate the Colorado exchange from what's going on at the national level, but it's hard to do that right now, especially because the legislature is going to have to react to so much coming out from Congress when it deals with things like Medicaid block grant funding that may come and other mandates being pulled back. I don't think this has a lot of legs, but it really starts the conversation about healthcare reform in an interesting way.
Healthcare reform. I like that. You should put a little TM on that one, Ed. I like that one a lot. Justine, the Republicans, at least Senate Republicans, made a clear sign from the very beginning they were willing to get into the partisan muck on this issue immediately. They weren't going to pull any punches. Where do you think at least House Democrats are going to be willing to jump into the partisan muck? Is it this issue or is it something else?
Definitely not this issue. I think Democrats are pretty much aligned with saving the Affordable Care Act and making sure that we're protecting the now, according to the governor yesterday, 94% of Coloradans who are now insured thanks to the Affordable Care Act here in Colorado. So I think that there'll be definitely some issues this year coming up where people will reach across the aisle, but this is not one of them, I do not think.
Clearly. Patty, as we just said, it's not a kumbaya moment to open up the Senate remarks, but do you think that we should even be expecting anything to come from a split legislature?
Well, on this issue, no, because you immediately heard Hickenlooper the next day and whether he had to change any of his speech to be very clear about the state's rights, and he wants to be able to keep this state program. He has a not-so-secret weapon in Donna Lynn, the lieutenant governor who had been at Kaiser, who certainly understands the healthcare system and I hope is working very hard on trying to come up with some kind of compromise for Colorado, especially considering that we have no idea what's coming from Congress. It makes, when they talk about we're going to get rid of Obamacare and with something really, really great. And it makes me think of when we were hearing about this wonderful new invention that was going to change transportation, and it turned out to be the Segway. I mean, that's what I'm thinking. We're about to get the federal Segway.
We've got a lot of great ideas that should be trademarked here. The federal Segway, I like that one a lot.